Hi, it's Mark from Remarkable Speaking. I'm here with Wil Seto of Insync Physio in Vancouver, one of Vancouver's best physiotherapist clinics, and we're going to talk about rock climbing and shoulder pain. How you doing, Will?
Yeah, I'm doing good, thanks.
So shoulder injuries from rock climbing, I guess this is fairly common.
Yeah, so rock climbing injuries in the shoulder are quite common. I mean, they make up, one of the top three in terms of injuries when it comes to climbing injuries, and primarily when we're looking at shoulder injuries, you can classify them as either, like traumatic type of injuries, acute injury, or non-traumatic, or I guess where you could say is chronic overuse type of injuries. And sometimes when we get these chronic overuse injuries, it can all of a sudden be like, oh, that's like a sudden acute thing. It never happened before. So what I'm speaking about specifically is this condition that is referred to as shoulder impingement. So the big question is, well, what is that? It's kind of an umbrella term because when we think of shoulder impingement, it's basically the things that are kind of in the shoulders that you have like basically certain structures like your tendons and the main structure in there, your rotator cuff tendons that can get pinched. And the main reason for that is usually there's an imbalance. And with rock climbing, you tend to overemphasize a particular set of muscles. And then there's also a set of muscles that are underemphasized. And so when you have this imbalance happening, then you can alter your mechanics in your shoulder. And just with the nature of climbing and in terms of overhead loading repetitively, and then especially when you're looking at, the types of climbing, if you're doing a lot of what's called bouldering, where you're not using a rope and you're just sort of climbing up short distances. And these days, when you go to the climbing gym, the bouldering gym specifically, where some of these problems that they call them root problems and bouldering problems are quite gymnastic-like, very parkour-like, and require a lot of like hanging and just with the arms. And then you do it over time and recognize like, in terms of the recovery aspect of it, then you can really start to run into problems.
So I'm sure it's probably a painful injury. What are other symptoms that are showing up?
Yeah, so the biggest one is that, it can happen during your training session or your climbing session, or it might not appear until the day after. And you start to get pain just with like trying to carry something. Like say you go to the grocery store and you notice, oh, it's starting to get a little bit of pain. And another thing is like you're maybe just reaching up into your cupboard to grab your mug for coffee or tea or your beverage first thing in the morning. So even just like lowering the shoulder down without any weight. And then you get this like sharp pinching pain. And so what ends up happening is that you have this imbalance that's already been developing there for quite some time. And so the individuals that are more prone to having this happen, are usually like beginners that are just starting up climbing, or even more advanced climbers who have taken a bit of time off, who just start back up again. And now they're just like learning how to reload their body. So you have sort of this muscle memory in your head, but then your body needs to also be conditioned. Or you may be like a seasoned climber, but now you're upping your training and you're upping your game. And with doing more higher intensity workouts or climbing sessions, when you're pushing the envelope a little bit more, now you really got to look at recovery in a different way. And part of that recovery, it isn't just about stretching. It's really looking at, well, where are you tight? Where are you imbalanced is the primary key to all this. Like, where are you really tight and basically always using those muscles all the time, or weak? Where are you not like uptrained enough where certain things can stabilize? So in your shoulder, you have muscles that work on stabilizing the shoulder so it moves properly. So you get better movement and mechanics happening when you're doing complex movements with loading and ballistic type of movements sometimes when you're climbing.
So how are you diagnosing this when someone comes in?
Yeah, so obviously after taking a history and asking questions, we run them through a bunch of tests because the biggest concern a lot of people have is like, oh, did I tear something? Especially if they come in and it's been like a week or 2 weeks, because you can actually have this type of faulty mechanics and you're getting this impingement. It could be going on for like 2, 3, 4 weeks and you just haven't done anything about it because you thought that maybe you could do it on your own and it just doesn't go away. So yeah, we take you through a bunch of different tests and look at what's going on. Our physio team, we see a lot of climbers and we run you through different things to do. And we look at, did you tear something? Did you actually tear a ligament in there? Did you actually potentially have a tear in your rotator cuff, which we can talk about in a different segment as well? Or is it more of a higher probability that it's just a mechanical thing going on? So usually if it's just a mechanical issue of what's happening in the shoulder and the rotator cuff with the impingement, then we usually get really, really excellent results in as little as like a 1 to 2 to up to 3 treatment kind of thing.
And so what is the typical course of treatment for this?
Yeah, so like I was saying, this kind of stuff usually doesn't happen overnight. So we look at the impairments, like the things that are not working properly. So maybe you've developed some stiffness in your actual shoulder capsule. So then we have to do some things and manually work that out. Maybe there's a lot of this imbalance where we got to manually facilitate mobility to go in that area. So we do certain things on a manual basis after we've assessed it. And it's pretty clear, like it's very clear sign if it's impingement, when we do these things, it's almost like instantly better if we're talking that it's just strictly a biomechanical thing and you don't have any tearing of the rotator cuff. And then what's really important after you feel this instant sort of like gains is the reinforcement of your mobility patterns that we give to you through mobility exercises and specific strengthening for stability and for functional strengthening, because we want to try and keep you climbing, as safely and as hard as possible.
So if you're having some shoulder pain that's suddenly come on, but maybe you've upped your game, rock climbing, bouldering, or you're just a beginner and suddenly you're finding, it's hurting. Get in to see the folks at Insync Physio. They're experts, they're rock climbers, they're people who know what's going on. They'll be able to diagnose it and get you feeling better. You can book online at insyncphysio.com, or you can call the Vancouver office at 604-566-9716, or in North Burnaby, have another office, 604-298-4878. You can book either of them online. Thanks, Wil.
You bet.